This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. We're outside the Aurora Medical Center in Oshkosh and we're heading up to the rheumatology department. We're going to be talking about fibromyalgia. It may have been something you've heard of before, but we're going to sit down with nurse practitioner Cindy Molson to find out everything you need to know. Well, thank you for taking some time with us today. I guess we've all heard through television commercials the word fibromyalgia, but exactly what is it?
It's a disease that affects the whole body, and it can be very painful, can have a lot of fatigue, sleep disorders, and you can even have memory problems with it. It affects your whole body with pain.
It seems like some of those symptoms a lot of people have just daily.
Yes.
When should a person become concerned that maybe this is something more serious?
Their pain can be exaggerated, so it's not a normal pain. Their pain, just a normal touch for you and I, seems to be feels more like somebody's punching them. So a normal touch is over-exaggerated.
Who gets fibromyalgia?
It can occur in anybody. It's a very genetic disorder, so if somebody in their family has had it, they may be more likely to get it.
Have you been able to pinpoint a cause for fibromyalgia?
Research has shown that it's more of a neurologic disorder. There is no inflammatory disorder, there's no autoimmune disorder. It doesn't affect joints in the sense that there's any physical abnormality with the joints, but people do have joint pain, muscle pain with it, but there is no damage to the joints.
Okay. We talked a little bit already about, I have some pain, but I don't know if it's fibromyalgia. So how do you go about actually determining, is it actually fibromyalgia?
There is no test for fibromyalgia. There's no lab work. There's no x-rays that you can do. So there's criteria set forth by the American College of Rheumatology that helps us diagnose it. If somebody comes in with specific symptoms that are pretty clear-cut, we don't necessarily have to do testing. But there's a lot of people who come in that we could think this might be rheumatoid arthritis, this might be osteoarthritis or hypothyroidism. So we can do tests to rule out those other disorders, but there is no test for fibromyalgia. There are criteria that we set forth, or that is set forth with certain tender points. We also look at the symptoms they have. People will have fatigue, the sleep disorders, the memory problems, headaches are common. We look at all those things, but there is no specific testing for it. Since
there's no specific testing, then is there a process of trying to eliminate that it's just normal aches and pains? So what would a normal aches and pains treatment be? Not fibromyalgia, but just the normal aches and pains that if you suspect fibromyalgia.
We would use anti-inflammatories, or some of our rheumatologic issues, we would use short courses of prednisone. None of those would treat prednisone does not treat fibromyalgia. That could help us rule it out also. Okay, so if
you go through everything, you rule out that it's not just normal aches and pains, it may be fibromyalgia, what then becomes the course of treatment?
There are several medications that we can use. There are things like Cymbalta. There is gabapentin and Lyrica. Other antidepressants can be used, things like Effexor. We use many non-pharmacologic things like acupuncture, massage, numerous things, chiropractic treatments. Many things can be used to treat it. Narcotics are not advised. They can make the pain prolonged and persistent. Exercise is really a good thing for fibromyalgia. Things like yoga, Pilates, swimming, that sort of thing.
Some of those drug names, I think some of us have become accustomed to on TV commercials watching any sporting event these days. But I understand there is a treatment here that's relatively newer that you're having some success with?
Yes, it's low-dose Naltrexone, and it works we've been having great success with it. It works on some of the cells, some of the same receptors that the opioids work on, and it works wonderful with our fibro patients. We've been using it for about 2.5 years now, and we've got patients that are back to their normal lives with this and working quite well. We've been prescribing it, and we have to see what dose the patients need, so we have them come back, follow up with me every month till we get them to the right dose. Some of them go back to their normal lives every day, and they're not hurting like they were.
That's great.
Yeah.
And obviously the goal, can this be solved over time? I mean, is this something that will go away over time, or is it something you always will have to deal with?
It's something people always deal with. So, yeah.
It's very difficult. So if a person thinks that they might have fibromyalgia, or they're experiencing some of the things you described, what's the best way to move forward? Is it to check with your primary care provider, or do we need to check in here at the rheumatology department right away?
I think a lot of it depends on their insurance. They can check with their primary care provider, and they can get a referral that way. If they can't seem to get a referral and their insurance doesn't require it, they certainly can come in and see us anyways.
Okay, well, this is all great information. We appreciate you taking some time with us
You're
today.
welcome.
Thanks to Cindy for all that great information. And if you still have some questions, you can always contact your primary care provider or us right here at the rheumatology department at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.